We last reported last night New York State putting a highlight on mental health communities in the state, many sharing their testimonies of either them or a loved one struggling with mental health or losing a loved one to suicide. And today we're tackling a different sector of mental health, that is youth homelessness and its correlation with mental health. Now, according to Plymouth Crossroads, a Western New York nonprofit that empowers at-risk youth, nearly a quarter of Erie County's homeless population is under the age of 25. And I spoke with a behavioral health specialist who shares how parents can utilize resources to help their child have better coping mechanisms. It's not easy being a teenager when you're surrounded by the pressures and influences in today's world. Sarah Wierzbowski of Best Self Behavioral Health wants teens to know that they're never alone. She says that there are ways that you as a parent can sense if your child is struggling with their mental health.
Maybe they're starting to isolate themselves more, they're worrying about things more frequently, a drop in their grades, change in their friend group, an increase in anger or aggression.
According to the World Health Organization, 50% of mental health disorders present symptoms prior to the age of 14. Wierzbowski says that there should be ongoing conversations or check-ins with your child in the home. Outside of the home, help is available by talking to a school counselor who can connect parents with agencies. She says parents should also be taking time to seek their own mental health services.
Do activities and things that are relaxing and calming for yourself and setting that positive example for your child.
Experts worry that lack of mental health discussions could lead to teens leaving homes. Best Self Homeless Services alone serves more than 150 homeless youths. Trying to curb the issue, Best Self opened up an overnight drop-in center called Safe Space at 430 Niagara Street to provide overnight services for youths who are experiencing homelessness.
So they're not couch surfing, going from house to house to dangerous places. And also advocacy, really staying on top of what's going on in the community, what the needs are.
Best Self's intake process includes speaking with specialists and outreach workers who go to every major shelter where homeless people frequent. They can also help people who are at risk of homelessness.
Connect them with legal services to stop an eviction if that's the issue, to work with their landlord on how to stay and make payment arrangements, access other resources that can keep them in their home if it's a safe place.
Bottom line, experts want youth and their families to know that help is available. Well, Spectrum Healthcare is another avenue for kids in crisis and can be reached at 716-882-HELP. Again, the number is there on your screen, 716-882-HELP.